Hello, and welcome to Wave Support. I see from your clinical request that you're struggling with a patient who's previously worn a tangent streak bifocal, and now you're trying to refit into a different design. It also sounds like you've tried some other options like the solutions from Soderbergh and maybe some other types of lenses. Well, if we take a look for a moment at your topographies, as you know, unfortunately, this is not a great topography as you've lost a little of the data from that upper lid. I see where you're trying to rebound by eliminating some of those outer rings. That's probably what I would have done also. But ultimately, you may be somewhat limited on using the topography to design your lenses because you don't have a whole lot of data here to work with. Just another general observation, I notice you've got this little red ring down here. I suspect that's from some corneal warpage from the patient's prior contact lenses. And just on a side note, what I found kind of successful or very helpful over the years fitting these wave lenses is that if you get a truly clean topography without any warpage from their prior lenses can be helpful. So quite often, if it's feasible, I have the patient stay out of their contacts for a day or two before I get a fresh, clean topography. And I know that's not always practical, but I have tried in a few cases have them just leave their lenses out the night before, get a fresh topography first thing in the morning before they go to work, so that way I have limit the amount of warping I have from their old lenses. And as you know, that's not always practical or feasible, but it's just kind of a side note that's very helpful if you can achieve it or if you can do that. So with this topography, ultimately if you struggle enough with this patient, you may need to go back and try to get a fresh topography. And I know you're trying to salvage this case because it sounds like you've had some number of fits and the patient's frustration level is rising. And I certainly get that and I understand how frustrating that can be. But with that said, let's take a look with what we have to work with. If I pull up your design here, your design actually looks pretty good overall. And one of the things you mentioned that the lenses tend to ride high and decenter a little bit. So without a lot of great topography to work with, there's not a whole lot you can do other than to get that lens to drop down. And probably the easiest thing to do, or hopefully the quickest, simplest step, is just increase the central thickness. And maybe take it up to about 25 or so. And that should significantly increase the center thickness, move that center of gravity forward in the lens, hopefully pull that lens back down. And that's really, you don't have a whole lot of choice to get that lens to center without a whole lot of topography to work with, but that's probably what I would try first. As far as the over refraction, I suspect since that lens is setting high, basically you're getting the -2 because the patient's looking through that ad. If we talk for a moment about the power in these lenses, if you recall, these are concentric circle lenses where the distance is in the middle and the reading is at the outer part. And actually these lenses basically kind of progress out, so you don't get the distinct demarcation that you would get in a tangent streak bifocal. So quite often I found that it's tough if somebody's used to that tangent streak quick shift in power, you might struggle a little bit with these concentric designs. With that said, I should mention Wave has a function of a segmented lens. And before I show that to you, if you notice right here in the traditional design, you have a center distance, and this is all thought to be reading. Again, keep in mind it kind of progresses through that area. If you go to the segmented design, you'll notice it creates a little bit of a crescent in shape lens. This is to kind of give you a little bit more like a tangent design. However, I haven't seen a lot of wave docs using this, and I haven't heard of a lot of enthusiasm about this particular design. So be aware it's out there. It could be an option for you, but any of these lenses, of course, won't help you a whole lot unless you get this lens centered. So to kind of summarize, for a quick fix, I think your best option is to try to take what you have and just try to beef up that central thickness, hoping that that weight will pull that lens down to try to get it to center more. That should help eliminate your over refraction and give you a fighting chance to get this lens to work well. If you're unsuccessful with that, then I would consider trying to get fresh, clean topographies on this patient and going back to the drawing board. And then ultimately, if you can't, I believe there still is tangent streak available. You might have to do a little hunting through your partner labs or hunt down the tangent streak manufacturer. So I wish you well with this. This is a difficult case. I know some of these are tough when you're trying to go from one design to another. Try not to get frustrated, and I wish you well with that case. Thank you for contacting Wave Support, and have a great day.